So today I'm mostly going to talk about contact lens care, and this is not just applicable for keratoconus. So this is for everyone who wears contact lenses in general, and some of the complications and issues that we do see. So just a really quick, brief overview. A lot of patients say, "Why do I have to take care of my contacts?" Well, what is contacts? So first of all, soft contact lenses. So imagine you're having this little plastic in front of your eyes, and these plastics will actually inhibit your tear exchange, your natural tear exchange on your cornea. Why do you have tear exchange? Because tears provide nutrients to your cornea. That's how your cornea stays healthy. With soft contact lenses, when you have a soft contact lens on, your tear exchange rate actually decrease to about 1 to 2% of the tear volume per blanks. So that's how much a soft contact lens will affect your tears and the health of your eyes. And also oxygen transmissibility of the contact lenses. The thicker the contact lens, the less oxygen that could be interchanged between the air and your cornea. And your cornea, just like any other tissues in your body, needs oxygen to be able to have a good survival, good healthy nutrients. So one of the two major ingredients or materials that we see for soft contact lenses are hydrogel. What's hydrogel? Hydrogel is basically a type of plastic that really loves water. So that's why you have to keep a soft contact lens hydrated in solution. Unlike hard contact lenses, they could be dry and they'll hold their shape. But soft lenses, it's not true because they're a piece of plastic that only holds this material with water. Actually, the water content allows the oxygen to pass through the lens to the cornea. So the higher the oxygen, the higher the water content of the hydrogel lens, the more oxygen can get into your cornea. The benefit of hydrogel is they're really good initial fit. So initially, when you put them on, they feel really good. However, throughout the day, as the lenses dehydrate, you actually get less comfort with the hydrogel. So a lot of companies came up with a solution for that issue. The overall comfort throughout the day is they put silicone on top of the hydrogel. So that's why you hear like SiHy, silicone hydrogel lenses. And what they do is they incorporate silicone within the hydrogel material. And the silicone actually allows more oxygen to pass through the lenses. And in this way, it actually allows more and better long-term comfort. And one of the main reasons that you want more oxygen is to prevent hypoxia, meaning hypoxia is basically lack of oxygen to your cornea. The downside is silicone tends to be a little bit stiffer than the hydrogel. And also the surface tend not to be wetted as good as a hydrogel. So a lot of the lens manufacturer has to add some solution to add wetting drops and agents to keep the lenses hydrated all day. So just a brief on this soft contact lens material. I'm going to go to the hard contact lens material. So as you can tell, hard contact lenses are smaller. They tend to have better tear exchange, about 10 to 12% rather than the 1 to 2% you see on the soft contact lens. Now I'm talking more on GPs. This doesn't apply for scleral lenses, okay? This is more for the smallest GP lenses. They do provide a little bit sharper vision because the lens doesn't change shape. Just like I was saying, the soft lenses, if you hold it in your hand, it just kind of molds and bends around, versus the hard lens, it just holds its shape. So that's why you get better optics and better vision with hard contacts. And there's two major types of materials that's being used for hard contact lenses, the silicone acrylate and then fluorosilicone. So they're just, again, different polymer silicones of plastics for better oxygen permeability. And the fluorine is added to the second one to enhance the mucin interaction. So it gives you more hydration on the lens itself and better comfort throughout the day. So this is what I really want to concentrate on today, is really the proper handling and care of contact lenses. A lot of patients don't think, well, contact lenses, I just put them in, clean them, and store them, it's fine. But usually I'll recommend both soft and contact lenses that you don't wear them to sleep. And one of the examples I'll provide to patients is if you remember back in school when we did biology, we did incubation of little petri dish with little microbes. And we put them in the little refrigerator to warm it up, and the next day we see a colony of bacteria. So my analogy would be, imagine the petri dish you have is your contact lens. And you put them in your eyes and you close your eyes to go to sleep, so you're kind of brewing a petri dish of bacteria in your eyes overnight while you sleep. So I know that's a little nasty, but that's sometimes I have to give that to kind of let patients know that's how comparable it is. So that's why I never ever recommend any patients to wear any kind of contact lens overnight. So you always have to make sure you remove them overnight. And also I'll follow all instructions for cleaning and storing. And this is the major part that we see a lot of complications with contact lenses because patients don't follow the proper protocols to cleaning and storing. Now I'll show you some examples, some interesting modalities I've heard in the past. And always wash your hands before handling any contacts, meaning when you put them in, take them out, anytime you have to touch the contact lens, always wash your hands. And so, yeah, go ahead.
Is there any particular wipe you recommend that if you're a new wearer and you're out somewhere and you can't wash your hands and you need to get them out of your eye? Is there any wipes that you would say are safe to use?
Yeah, there's like saline wipes. I know that's in like say Walgreens stuff, but I would say at least the most you can do is a hand sanitizer, even though I don't like that because sometimes it has alcohol in it. But if you're just to remove it, at least use that and remove it and store it in your case.
Okay.
Yeah, just for emergencies. But usually, again, always hand washing.
Okay.
Yes, good question.
Thank you.
And so for soft and hard contact lenses, same thing. Make sure you safely remove the contact lenses with clean hands or plunger. And after removal, rub the lenses gently in the palm of your hand with fingers. And I usually tell patients just like this and put your lenses in the palm and just kind of digitally rub it. And why do you want to rub it? Because the actual action of you rubbing is how you actually can mechanically dislodge the protein debris that's stuck on the lens. Because these are plastic materials that you're talking about, and these over one day of use, a lot of debris and protein can actually get caught and stuck on the lens. But if you just take them out and put them in your solution without rubbing them, the debris and the protein can still be stuck on that lens, and you don't know, and the solution doesn't really take it away. And always fill contact lens with fresh contact lens solution. I know some of you might think this is really elementary, but you'll be surprised. A lot of patients will take their contact lens out in the morning, put them in, and leave that same solution. They store that same lens overnight, and in the night, and put that lens back in that same solution. So I always have to reiterate this. Every morning, you take them out, you dump that solution down the drain, you rinse your case, and let it air dry. And then every night, you put a new solution in, and then you store your lens. And close and make sure you close the case. Some patients will just put the solution in and not close the case. There's all those little particles falling in your case throughout the night, so make sure you close the case and you store them. And like I already said, make sure you dispose all solutions and rinse the case. So just little examples of how to properly and safely remove your contacts, and I think Dr. Blaze went over a lot of them already, so I'm kind of skip that over. But like I was showing, I always ask patients to make sure you put it in the palm of your hands, squirt some solution in, and then rub before you store your lenses. So I'm actually going to go through some soft contact lens solutions and what they're different. So a lot of patients ask me, well, all these solutions, what's good, what's not? Honestly, I don't have a preference. Everyone's a little different. Everyone reacts a little different to each solution. I usually just tell patients, I'll provide them a starter kit when they come and see me for contact lens fitting. And if one solution doesn't work out, I'll let them try different solutions until they find the right solution that works for them. So some of the more common solutions we have right now is what we have. This is mostly for soft contacts. It's the Complete. The Complete has an easy rub cleaner that they claim has a broad spectrum of bacteria, microorganism cleaning, and it's effective cleaner, but it's also gentle on the eyes. So this hopefully will answer some questions why patients say, well, why do I need a soft contact lens cleaner? Why can't I just use saline? This is exactly why, because a lot of these contact solutions has built-in cleaners and have these antimicrobial elements in it. So that's why you want to use a contact lens solution, not a saline solution, because saline solution has nothing in it. So that's why it's not going to help you kill all those macrobacteria on your contact lens. Revitalize is one of the newest contact lens solution right now. They're marketed for a very broad spectrum of disinfectant, and actually they're one of the few that claim that they have a peroxide quality cleaning, but you don't have to go through the bubble, leave it overnight. But you could still just put them in a couple hours and still put them in. And They advertise for a lot more comfort, and at the same time, when you store it in their case, the antimicrobial activity will actually continue on as long as you put the lens in this case. Now, the next one will be for BioTrue, and BioTrue, what they're advertising is the solution actually matches the pH of your healthy tears. So some patients will feel that these solutions don't sting as much because they're more around the pH about 7.4 of your tears. So that's what BioTrue advertised for. And next we have the two more popular ones are the OptiFree. So you'll probably see a lot of OptiFree Replenish, OptiFree Pure Moist. A lot of patients ask me, what's the difference? So OptiFree Replenish has the Tear Glide, and OptiFree Pure Moist has a HydroGlide. Now, what's the difference between Tear Glide and HydroGlide? Tear Glide will work mostly on your own tears. It will actually provide a shield on your tears, versus the HydroGlide actually coats the lens, the contact lens itself. So two different ways they try to work together with your tears and your eyes and your contacts to make things more comfortable and more hydrating throughout the day. So ClearCare and Renew, I think most of you know the ClearCare. So ClearCare is a hydrogen peroxide solution. You cannot put this directly in your eye. You actually have to put it in the case, and at the bottom is actually a platinum encased plate that neutralizes the peroxide into pure saline after 6 hours. So that's why you cannot wear these contacts unless you soak them for 6 hours in this case. And a lot of patients forget you keep using this case over and over again. It actually gets deactivated throughout time, and the platinum plate will not deactivate the peroxide. So usually when you buy these solutions, they'll give you a new case. So don't try to say like, oh, I'm going to save this case for something else. No. Every time you buy the solution, you always want to replace that case. When they give you a case, you should start using the new case. And these are really good for patients who's really sensitive to preservatives. All the solutions I've talked about all have preservatives. Peroxide systems don't have preservatives. So if you're one of the patients that's more sensitive to any type of preservative, I would do the ClearCare. And then Renew is also another solution. It's again trying to formulate to work better with your natural tears, and also claims to fight germs and cleans lenses and remove any kind of irritant protein from the soft contacts. And they also have a solution for more sensitive eyes. And all these, and I know most of the soft lenses will advertise that you don't have to rub. Even though on the advertisement they say don't rub, I still tell patients rub. Just go ahead and rub that lens and make sure you dislodge all the proteins and debris that's stuck on the lens. So I'm going to talk about some common hard contact lens solutions. So the Aerocept and the Peroxyclear can both also be used on hard contacts and soft contacts. So Aerocept is also the 6-hour modality peroxide system. The difference between Peroxyclear is they advertise that they only need 4 hours instead of 6 hours to neutralize that hydrogen peroxide to saline. So that's the only difference between the two. And the Optimum, I know a lot of patients for hard contact lenses really like these. They have the clean, disinfectant, storing solution. Also the rebutting drop they can use before they insert the lens and also during the insertion. And their claim is they tend to be an allergy-free care system. And the next one will be for Boston. Boston, they have the Simplex, the one lens, one system, the both cleaner and conditioner, or the conditioner and the cleaning system, and the weekly cleaner. Now, Boston, everyone's a little different. I have some patients says, Boston, they don't feel as comfortable. They get a little bit more allergy reactions to it. And actually, when I switched them to the two modality with this, the cushioning and the cleaning separately, they do better with it. Some patients say the Simplex doesn't give them that extra cushioning or wetting on the hard lenses, and some patients prefer the two system where they feel the other rebutting drop has a little bit more cushion for their hard contact. So everyone's a little different. So I wouldn't say there's one solution that fits all. Make sure you try them all and find which one fits you the best. And so a couple of things I really want to go through. And this is the main slide I really want to go through, so that's why I kind of flew through that. So number one, I know it's kind of insane I'm saying this, but please don't use saliva. Some patients, mostly for hard contacts, I do have some patients say, oops, I was playing sports and my hard contacts fell out and I don't have solution, so what's the next thing that has some solution? It's my mouth. So they'll put it in their mouth, rinse it a little bit, and put it right back in their eye. So please don't do that. That's a not very good idea. And the next one is as crazy as it sounds. I actually do have patients with hard contacts put their contacts in yogurt. And they said it's a great cushioning agent for their hard contacts. And one patient told me one flavor is better than the other, and I don't want to know what flavor it is, but that's a big no-no. Also, tap water. Tap water, that's not an agent that you should be using in your eyes. Definitely not something you need to clean your contacts with. Never ever. There's too much microbial agents in there. You just don't want that be soaking on your eyes and taking in all the microbacteria. Again, I always have to reiterate, never reuse solutions in cases. And also the other thing I forgot to put on there is anytime if your cases are kind of yellowy or there's some kind of gunk around it, make sure you replace your lenses, your cases. Some patients will use the same case for a year. Cases, I usually recommend patients replace them every month if you can, but at least 3 months, you always want to replace your cases because, again, over time, these cases can have these little microprobes that can have bacteria that gets stuck in there, and if you don't change them, all these bacteria are just growing in this case and getting attached to your lenses every single night. So make sure you always replace your cases, and never share your contact lens with anybody. Yes, some patients will say, "Oh, this one works great. Why don't you try it out?" Don't share contact lens with anybody. And also replace your contact lenses as scheduled. Again, if you have 2-week lenses, make sure you replace them every 2 weeks, not every 2 months, not every 2 years. Replace fresh new lenses as what the design of the lens is for. I hear a lot of patients with 1-month lenses, they'll say, "Well, I'll just replace them when I feel they're not comfortable." That's not a good idea. Again, all these bacteria, all this debris and protein can be stuck on that lens. And when you feel that's uncomfortable, you don't know what's been growing on there already. So always make sure if it's a 1-month lens, you always replace it 1 month. Daily lens, every single day you toss and you shouldn't even be storing them. And also you can also use contact lens eye drops during eyewear. Non-preserved artificials are perfect. Some patients like to use like Bising. I really don't recommend that for contact lens. And one of the company actually has a special contact lens eye drop just for contacts. So it's called Blanks Contact. So that's something you can actually look for too. So there's.
You wear that for scleral lenses?
Yeah, I actually recommend patients. So that's for all contacts. Yeah. And again, some patients still don't believe that what I'm saying is true, that you have to take good care of your contacts. So I need to kind of explain to them why. Why is it so important to have good contact lens hygiene? Number one is you always want to go back to your doctor for all your follow-ups. If we fit you today, that we need to see you for a follow-up to make sure everything fits correctly. And why? Because a poor fit will cause poor vision, poor comfort. If the lens is fitted in too loosely, you're going to have irritation on your upper lids. You're going to have injection, basically redness in your eyes. You're going to feel that lens moving all over. It's just not comfortable, and your vision's not going to be great. If it's too tight, you might not feel that movement, but you'll still notice the redness in your eyes. And you can also cause some cornea edema, basically causing your cornea to swell up because it's not fitting you correctly. Also, if contact lenses aren't taken care of properly or fitted correctly, you can have dry eyes issue because you reduce that tear exchange and you're decreasing nutrients to your cornea. And same thing, if you don't have good fit, you're going to have hypoxia, which is lack of oxygen to your eyes, and that could cause some new blood vessels that's growing into your cornea, which you don't want. And allergies. So allergy could be to the contact lens itself or to the solution, different reasons that you might have allergies to, or even seasonal allergies. Some patients have nasal allergies that can kind of flare up into their eyes. That's again, anytime you have any discomfort with your contact lenses or vision is not as good, you go back to and see your eye care professional right away. And some of the, this is one of the more common complications I do see in clinic is infiltrates. So infiltrates are basically inflammation on the cornea caused by poor contact lens hygiene. And that's basically reactions to the debris or any kind of microbial activities that's on your lens. And that will actually cause very small peripheral, local, or multifocal, these corneal white lesions on the cornea. If it's off to the side, you're lucky because it's not going to affect your vision. But if just one gets into your central vision, it can actually affect your vision and cause a scar. and that's something you don't want. Another side effect will be infectious keratitis, and that's instead of inflammation, now you're having an infection instead. And this you will definitely feel. Infiltrate, a lot of patients don't feel it. There's no pain, there's nothing except that you just feel your eyes are not right with your contacts. That's the only thing you'll feel. And some patients will continue to wear contacts. That's actually going to make the condition even worse. Now, infectious keratitis, you'll actually feel it. You'll see it. You'll feel the pain with and without contact. You'll see the redness. And for us, we will see these little white spots, and we'll actually see some defect on your cornea as well. Next will be giant papillary conjunctivitis. This is probably by far the most uncomfortable symptom for all patients. So basically, you will, when we see it, we'll invert your lids and we'll see all these cobblestones on your eye, under your eyelid. And what happens is these cobblestones are catching onto your contacts and moving these contacts as you blink. So that's why a lot of patients will say, well, how come my contacts are just moving everywhere as I blink? And this is exactly why. And then also SPK is on the corneal surface, and this is again due to poor contact lens fitting, dryness, or even contact lens solution. It's not any kind of damage on your cornea, but it is a corneal reaction. And like I said, just kind of reiterate, any symptoms of pain, redness, irritation, light sensitivity, blurry vision, or new onset of any kind of discomfort, just go ahead and discontinue all your contact lens wear and see your eye care professional right away. So just wanted to show you guys what I'm saying, the GPC, all the little cobblestone. I know, I have to show this to scare everyone, right? So the GPC was what I was talking about, all the allergy and everything. And imagine this, when you close your eyes, it's all catching onto your lens and just moving your lens everywhere. And then the bottom is the infectious keratitis, and the little white lesion is what I was talking about the infiltrate. And this is definitely, you see the little blood vessel coming onto your cornea on the top, and this is what you don't want, and all the redness and irritation. So I really want to talk about severe contact lens complication, and this do occur. And then Dr. Gard mentioned that we do have quite a few amount of cases of severe contact lens complications. So one of the two is Cantaniba. These are actually tiny one-cell parasites, and they're found mostly in water sources, such as tap well water or homemade solutions for contacts. And like I said, using tap water, saliva, or yogurt. This is exactly why you don't want to use any of the above. Or patients wear their contact lenses, go to hot tubs, swimming pools, or shower with contact lenses. Mostly patients you'll definitely know it because you'll feel the pain when you remove the contact, and you'll see it with the redness, and you have a lot of tearing. You're going to be very light sensitive, and your vision's definitely going to be affected, and you're going to always feel like there's something in your eye, so that foreign body sensation. If you see on the picture, you can see why it's affecting your vision, because that lesion is right in the center of your vision. And for us, what we see is we see all these cornea's top epithelium layer is going to be all regular, and you're going to have a lot of the infiltrate like I was talking about, and you're going to have dendrites, and other signs will be more infiltrates on the deeper layer of your cornea, and you're just going to have a lot of lesions and defects on your cornea. So you definitely don't want that, because you can end up with a corneal perforation, and that's again something you don't want when you have a good healthy cornea, or even with keratoconus, you don't want more perforation on your cornea. So Pseudomonas, it's one of the more severe type of contact lens complication. This is actually a bacterial. So this bacteria actually has a flagella and two different strains, and they're mostly found in soil, water, and vegetation, skin, and some man-made environment. And they'll cause a microbial keratitis. And why they tend to be a complication with contact lenses is because the flagella actually adheres to the contact lens surface a lot easier than other pathogens. So that's why we might see Pseudomonas a little bit more commonly than Acanthamoeba. And again, some of the signs not as significant as Acanthamoeba. Patients just feel some pain, photophobia, discharge, but you'll definitely notice a decrease in vision. And for us, we'll see the grayish white infiltrate again, the epithelial defect, and the redness in the eye, and significant lid edema, and also a lot of cells and flares, basically inflammation in front of your eyes. And so this is another picture. And so I'm sorry, I know, but I have to put these on to kind of scare everybody. And this is a perfect example of what a pseudomonas eye would look like. All these inflammation, the redness, and you could tell you probably cannot see through that cornea, because it's all inflamed and affected by this bacteria. So how to prevent it? Good hygiene, good compliance, follow up with your eye care professional as scheduled, never sleep in your contact lenses, and any kind of new, unusual, or any kind of discomfort, even if it's a little, just stop your contact lens and come in and see your doctor. We love to see you. We'd rather have you come in and be nothing than have you wait out and be actually something more severe. And always have backup glasses, because some patients, if you're -10, you don't have backup glasses, you're kind of forced to wear your contacts because you have to drive, you have to run around and do your daily routine. So make sure you always have backup glasses, even if it's not to the right prescription, something close to get you by so you can come and see us. So the next topic I'm going to go through is a lot of my patients when I do low vision come in and ask, especially with keratoconus, glare sensitivity. So this glare happens when there's too much light there, or if the luminance range is too large. There's two types of major glare issues that we see in patients. There's this discomforting. Discomforting just kind of makes you want to close your eyes and look away. But the stabling glare that really affects most of my keratoconus patients. What the disabling glare is actually caused by the internal reflection of the light within the eye, and it reduces your contrast. And I have images to show you what I mean when I say reduce the contrast. In general, in theory, I should say, short wavelength tend to disperse more, therefore tend to be more of the bothering glare that most patients have symptoms of. And usually the short wavelength is around 480 nanometers, which is the blue wavelength. So sometimes patients will come in and say the blue light or something around the violet effects they're more sensitive to. So the goal is to reduce that kind of glare issue. We try to decrease that wavelength of light that's coming through to affect your vision and causing you all the discomfort. So I think Dr. Wade had this photo in his lecture, but I just want to show this is why with keratoconus you have a little bit more glare issue, because a good eye, a normal eye, you'll see the light ray will focus on one point. Now keratoconus, you have this dispersed image. Not only is your image dispersed, but the light ray comes in different directions. So that's why a lot of patients with keratoconus will have more issues with glare, because you're just having all these light coming in different directions at you. And our goal is to, unfortunately we can't get rid of all the light ray coming in, but at least reduce some of the affecting light ray that's causing the glare issues for you. And when I talk about the lower spectrum of light, so if you see for our visible light, we see this 400 to 700 nanometers. And when I said 480, which is the blue spectrums, tend to be more of the affecting light ray that causes the glare discomfort. So there's a difference between filters and tints. A lot of patients felt like, filters are just a type of tint, but they're actually two different items that you can have in your glasses. Most sunglasses that you can get, so say, in any kind of optical shop are mostly tints. Now, what tint does is just reduces the overall light entering the eye. So therefore, the darker the tint, the less light that can enter the eye. However, filter is a little different. Filter filters out that specific light, while at the same time allows the other useful light to enter the eye. So that's the difference. One filters out the wavelength, one decreases all the light. So that's the difference between filters and tints.
Which would you recommend more?
I like to recommend filters. Filters are harder to get. There's only a couple of labs that really does a good job on filters. When I did low vision, I had a stack of lens filters I'll go over with patients. I actually do test patients indoor and outdoor, because we don't just live in dark rooms. We actually go around outside. I actually do test them differently, and I do find that different settings patients need different filters, and that's why it's really important to get tested. And also I want to know, that's a good question, because everyone's a little bit different in terms of light sensitivity, just like everyone likes different colors. I might like red and another patient might like blue. So our sensitivity to different lights and colors are different. And I'll kind of go over at the end too what's the recommended and what I usually clinically do. Yeah, so these are filters where, filters again has different colors, and they have specific tasks that they're designed for, such as the graying. The graying we use it for fishing or skating or road biking, down to the more darker browns. We use them for mountain climbing and glacier skiing. That's because, again, the filters will filter out specific light rays, but it still allow other light to come in. Now the tint, again, is different color, different intensity to lower or increase the overall light coming into your eye. So the main function of tint is to reduce the ambient light intensity for your increased comfort and increased vision. And you can see the difference between clear and dark areas and appreciate the colors and still details and shape. Okay, so the other, these are also two other filters I like to do for low vision patients, polarized and neutral density. Polarized actually filters that blocks reflected light at horizontal plane. So basically things that is reflected off, say on the surface of your dashboard, or the surface of your car, or the surface of your water. But anything that's not reflective, anything that's directly coming onto, filters will not, polarized lenses will not filter that out. So that's the difference between a filter, tint, and a polarized lens. So if you notice, if you do have a polarized sunglasses, if you take it to your LCD or computer, you turn it 90 degrees, you'll notice it's all blocked. Because polarized filters are filtered aligned vertically. So if you turn it, so they will, once they're aligned vertically, they will filter out the light ray that's coming towards you as a reflectant vertically, horizontally. So that's why when you turn it 90 degrees over, it'll filter out the LCD, which is actually aligned vertically. So that's how polarized lenses work, is they only do filter out the reflective light on the horizontal plane. Now, neutral density filters, I actually like the neutral density filter a lot because it reduces the intensity of all wavelengths. So it kind of just reduces all the glare, and I find a lot of patients find it more comfortable with neutral density lenses. Because they don't alter the color, but they just kind of decrease that intense amount of light that's coming through towards you. And usually, in general, that's the gray color filter that I find that's pretty successful in most patients. So I just want to show you really quickly the polarized. So if you guys, you can see the glare coming off of the ocean water is more glary versus when you see through the polarized, it takes away that reflective light. So that's a polarized lens. And here's the neutral density. So the one with the no filter is what we say when you have a glare issue that causes you to have discomfort is lowers the contrast. So when you have no contrast or low contrast, you could tell everything just seems kind of about the same, right? So the sky just looks, overexposed, you could say, and the water just looks a little bit darker, seems a little bit darker than the sky. Versus when you have the neutral density, it decreases the overall light ray, so now it helps you increase your contrast. And contrast is where a lot of patients will have trouble if you have too much glare. Everything just bleached out. You can't see where things are. Even find things like going off a step. If you don't have good contrast, you're not going to know where is the end of your step. So in closing, by theory, so this is by theory. So because most of the 480 nanometer, which is the blue light ray, causes more glare, technically we want the orange-yellow filter because anything that's, so basically how filter does is it filters out anything that's below. So orange and yellow is at 600. So it'll filter all the 600 and below light, the wavelengths of light. So in theory, we would say orange filters is better to filter out the short wavelength, which causes more of the scatteredness and causes more of the glare issue for patients. But clinically, I found more of the green-gray that does better for patients. Like I said, again, going back to the neutral density, it just kind of overall decreases all the intensity but all wavelength, and most patients do better with that in terms of glare control. Also, some of the new lenses that's coming out is polarized gradient gray, and also transitions. Transitions where when you step outside, it'll change color. There's special filters that actually has a little tint indoors, and when you go outside, it gets even darker. And also, I always recommend anti-reflective coating for all patients because that in general will reduce some of the glare. And that's it. Thank you.